Question 1. Which of the following is the most common cause of dehydration in infants? A. Urinary tract infection. B. Diarrhea and vomiting. C. Excessive sweating. D. Congenital heart disease. Correct. Answer: B. Diarrhea and vomiting. Explanation: diarrhea and vomiting cause significant fluid loss, leading to dehydration, a serious concern in infants. Question 2. Which reflex is normally present at birth and disappears by 4 to 6 months of age? A. Babinski reflex. B. Moro reflex. C. Rooting reflex. D. Stepping reflex. Correct. Answer: B. Moro reflex. Explanation: the Moro reflex, startle reflex, disappears by 4 to 6 months of age and is an infant's response to sudden movement or noise. Exam Pharmacy offers a range of study services to make your life easier, from online quizzes, assignments, and research papers to midterm and final exam prep. Need help? Just message us on WhatsApp and we'll take care of the rest. Let's make studying stress-free together. Question 3. What is the most common congenital heart defect in children? A. Atrial septal defect. B. Ventricular septal defect. C. Tetralogy of Fallot. D. Patent ductus arteriosus. Correct answer: B. Ventricular septal defect. Explanation: VSD is the most common congenital heart defect, causing abnormal blood flow between the heart's ventricles. Join our WhatsApp group now. Click the link in the description for more study support. Question 4. Which of the following is the primary sign of respiratory distress in neonates? A. Cyanosis. B. Nasal flaring. C. Clubbing of fingers. D. Weight loss. Correct answer: B. Nasal flaring. Explanation: nasal flaring is an early sign of respiratory distress, indicating increased effort to breathe. Question 5. Which vaccine is administered at birth as part of the immunization schedule? A. MMR vaccine. B. Hepatitis B vaccine. C. DPT vaccine. D. Rotavirus vaccine. Correct. Answer: B. Hepatitis B vaccine. Explanation: the first dose of the hepatitis B vaccine is given at birth to prevent hepatitis B infection. Question 6. The APGAR score is used to assess a newborn's condition based on A. Birth weight. B. Skin color, heart rate, reflexes, muscle tone, and respiration. C. Blood glucose levels. D. Serum bilirubin levels. Correct answer: B. Skin color, heart rate, reflexes, muscle tone, and respiration. Explanation: the APGAR score is used at 1 and 5 minutes after birth to assess a newborn's health. Question 7. Koplik spots are an early sign of which disease? A. Measles. B. Rubella. C. Chickenpox. D. Mumps. Correct answer: A. Measles. Explanation: Koplik spots are small white lesions in the mouth that appear before the measles rash. Question 8. Which condition is characterized by a seal-like barking cough in children? A. Croup. B. Asthma. C. Pneumonia. D. Tuberculosis. Correct answer: A. Croup. Explanation: Croup causes inflammation of the airway, leading to a characteristic barking cough. Question 9. Which of the following is the most common cause of pneumonia in children under 5 years? A. Streptococcus pneumonia. B. Mycoplasma pneumonia. C. Staphylococcus aureus. D. Pseudomonas aeruginosa. Correct answer: A. Streptococcus pneumonia. Explanation: Streptococcus pneumonia is a leading cause of bacterial pneumonia in young children. Question 10. The most common cause of neonatal jaundice is A. ABO incompatibility. B. Physiological jaundice. C. Sepsis. D. Hepatitis. Correct answer: B. Physiological jaundice. Explanation. Physiological jaundice occurs due to immature liver function and resolves on its own. Question 11. Which vitamin deficiency causes rickets in children? A. Vitamin A, B, vitamin B12, C, vitamin D, D, vitamin K, E. Correct. Answer, C, vitamin D. Explanation. Vitamin D deficiency leads to rickets, causing weak and deformed bones in children. Question 12. The primary cause of iron deficiency anemia in children is A. Genetic disorders, B. Inadequate dietary intake, C. Vitamin B12 deficiency, D. Infection. Correct answer, B. Inadequate dietary intake. Explanation. Lack of iron-rich foods is the most common cause of anemia in children. Question 13. Which of the following is the most common type of leukemia in children? A. Chronic myeloid leukemia. B. Acute lymphoblastic leukemia. C. Multiple myeloma. D. Hodgkin's lymphoma. Atordri. Correct. Answer. B. Acute lymphoblastic leukemia. Explanation. Acute lymphoblastic leukemia, ALL, is the most common childhood cancer. Question 14. Which sign is an indication of severe dehydration in children? A. Dry mouth. B. Sunken eyes. C. Decreased urine output. D. All of the above. Correct. Answer D. All of the above. Explanation. Severe dehydration presents with sunken eyes, dry mouth, and reduced urine output. Question 15. What is the primary treatment for Kawasaki disease? A. Antibiotics. B. Aspirin and intravenous immunoglobulin. C. Steroids. D. Antihistamines. Correct. Answer B. Aspirin and intravenous immunoglobulin. Explanation. Kawasaki disease is treated with IV immunoglobulin and high-dose aspirin to prevent complications like coronary artery aneurysms. Question 16. What is the leading cause of death in children under 5 years worldwide? A. Malaria. B. Pneumonia. C. Diarrheal diseases. D. Measles. Correct answer B. Pneumonia. Explanation. Pneumonia is a major cause of death in children under 5 due to respiratory failure. Question 17. The most common cause of bronchiolitis in infants is A. Streptococcus pneumonia, B. Influenza virus, C. Respiratory syncytial virus, RSV, D. Mycoplasma pneumonia. Correct answer, C. Respiratory syncytial virus, RSV. Explanation. RSV is the most common cause of bronchiolitis in infants. Question 18. Which of the following is a sign of meningitis in infants? A. Bulging fontanelle. B. High-pitched cry. C. Poor feeding. D. All of the above. Correct answer D. All of the above. Explanation. Meningitis in infants presents with a bulging fontanelle, high-pitched cry, and poor feeding. Question 19. Which of the following is a sign of hypoglycemia in a newborn? A. Jitteriness. B. High-pitched cry. C. Lethargy. D. All of the above. Correct answer D. All of the above. Explanation. Hypoglycemia in newborns can present with jitteriness, lethargy, and a high-pitched cry due to low blood sugar levels. Question 20. What is the primary cause of hydrocephalus in infants? A. Excess cerebrospinal fluid, CSF, accumulation. B. Birth asphyxia. C. Vitamin D deficiency. D. Hypoxia. Correct answer A. Excess cerebrospinal fluid, CSF accumulation. Explanation. Hydrocephalus occurs due to excessive accumulation of CSF in the brain, leading to increased intracranial pressure. Question 21. A child with cystic fibrosis is at increased risk for A. Frequent respiratory infections, B. Hyperthyroidism, C. Kidney failure, D. Hypertension. Correct answer. A. Frequent respiratory infections. Explanation: cystic fibrosis leads to thick mucus buildup in the lungs, increasing the risk of recurrent infections. Question 22. Which of the following is the primary concern in an infant with diarrhea? A. Fever. B. Skin rash. C. Dehydration. D. Abdominal pain. Correct answer. C. Dehydration. Explanation: dehydration is the most serious risk in infants with diarrhea due to excessive fluid loss. Question 23. Which of the following is a characteristic feature of Down syndrome? A. Hyperactivity. B. Large forehead. C. Simian crease, single palmar crease. D. Increased muscle tone. Correct answer. C. Simian crease, single palmar crease. Explanation: a simian crease is a single deep line across the palm, commonly seen in children with Down syndrome. Question 24. The most appropriate intervention for a child experiencing febrile seizures is A. Administering aspirin. B. Placing the child in a supine position. C. Keeping the child safe and preventing injury. D. Giving cold sponging with ice water. Correct answer. C. Keeping the child safe and preventing injury. Explanation: during a febrile seizure, the priority is to keep the child safe and avoid injury while ensuring airway patency. Question 25. Which of the following conditions is characterized by an absence of ganglion cells in the colon, leading to severe constipation in infants? A. Hirschsprung's disease. B. Intussusception. C. Pyloric stenosis. D. Celiac disease. Correct answer. A. Hirschsprung's disease. Explanation: Hirschsprung's disease results from the absence of ganglion cells in the colon, leading to poor bowel movement and severe constipation. Thanks for watching. If you enjoyed this video, don't forget to like, share, and subscribe. Stay in touch for more videos, and we'll see you in the next one.